Hi, my name's Kath and I'm the project manager for NCT's Parents in Mind in the Northwest. I've put together this video to tell you a little bit about what Parents in Mind is and the kind of support that we offer, so you can have a listen and see if we might be helpful to you at the moment. So NCT is a leading parenting charity and we support parents and their carers and support networks from finding out that the family is expecting a baby up until baby's about 2 years old. So they call it the first 1001 days, and that's the same period in which we support parents within Parents in Mind. So the service itself, as I say, we are a charity. We're not linked with anyone locally and we're not a clinical or a medical service, but we can offer signposting and we work closely with partners in the Northwest from health visiting, from midwifery, from other third sector organisations such as Citizens Advice Bureau, places like that where the families that we're working with might find more information or help or answers to questions that they have that perhaps we can't support them with. But we're not linked to any of those, so there's no obligation to follow those up, but we like to try and share that information and support our families to access what they need outside of the support that we offer. The support we offer, as I've said, is non-clinical, non-medical. We are experts in the challenges that we all face in being parents, and we want to offer our families and partners the opportunity to talk about the challenges that it brings being a new parent, whether that's a new parent to your third child or your first child or to a stepchild. We want to be there to offer you the opportunity to talk about that with another parent who is a volunteer who has lived experience of having had difficulties themselves with their mental health or emotional well-being when they've had a little one. So our sessions are all talk based, and as I said, we've not got the answers. We can't write prescriptions. We are there to give opportunity to talk and connect with our volunteers and indeed with other parents that we're supporting in perhaps our group spaces such as our park walks or our community centre sessions, or we have a WhatsApp space online and we have some Zoom spaces online where you can actually link up with other parents and talk with them whilst being supported by our volunteers. But our volunteers also offer one-to-one sessions, whether they are again remotely over the phone or whether they're face-to-face park walks or sessions within children's centres, or whether that's something that you want to access sort of online. So we offer a space to talk and to feel heard, and as much as it's a complete blessing to be a parent, it is a total emotional roller coaster. And we work with families who have had really, really difficult journeys through pregnancy or even before that and suffered multiple miscarriages and had difficulties conceiving a child. We have families who have gone straight through all of that bit, really textbook, and then this baby's arrived and it's been not what they expected at all, and it's really been quite challenging for them emotionally to manage that little one and their needs in light of sometimes other family dynamics as well. So we're here to give you time and space to talk about that, to have a cry, to have a moan, to have a laugh, to have an offload with other parents who feel similar. So we offer support to mums, and we have mum-based spaces, and we also offer support to dads and to stepdads, dads who've taken on additional children that are not their own, to same-sex families, to partners who are closely supporting the family and the little ones. So that might be grandparents or aunties or uncles or sisters. We're there for anyone who is an active caregiver to a child under 2 years who is feeling that they're struggling with their emotional well-being and would like to connect with others that have raised little ones and know how those challenges feel. So like I say, we're not here to kind of give solutions to those challenges, but what we hope is by connecting with other parents, whether that's our volunteers or the wider group of parents that we're supporting, and having those conversations, as parents we then feel validated in thinking actually it really is hard, and it's okay not to jump out of bed every day and punch the air and think, isn't this amazing? A lot of being a parent is a bit of a trudge and is really difficult emotionally and is tiring and exhausting, and the incessant wiping and press stud fastening and being there and being on, never having that downtime is just horrendously difficult at times. And we want to be here to talk about everything that being a parent is, because having become a parent, you still have that part of your life that's you, even though you feel like you've lost touch with it. You aren't ever just a parent. You are still a person in your own right, and you're entitled to all the feelings that becoming a parent brings. You don't have to continually convince yourself that every day is a bowl of cherries and is amazing. You can love your baby to pieces and be absolutely sick of the sight of them all at the same time, and that's what we're here to talk about that with you, and also celebrate the things that you won't even realise you're doing amazingly with every day. All those sort of superhero things that you do at 2 o'clock in the morning when your baby needs you, and you're out of bed again, and you're providing for them, and you're giving them what you need, and you're building that family unit and that stability and support that your little one will draw on into the future as they grow up. They're the parts that really are the superhero things, not necessarily the day of the first steps or the first words or starting to roll over. They're amazing, but they all happen because of what you gave of you in those late night feeds and changes and all that kind of stuff. So we're here to hold your hand and talk with you about that and share something of us. It's not a counselling service. We're not here to just ask questions and nod along. This is peer support, so it's side by side. So the parents and the carers that are supporting you, they too will be sharing their experiences as a parent, and you can kind of compare notes, if you like, and bounce ideas off each other about how that feels. So I just wanted to kind of give you a flavour that we're not clinical. We don't think we've got all the answers. We feel that we're very much part of a toolkit, and we can help support you to other services as well that might be able to fill that up for you. But unlike physical difficulties, mental health and emotional health difficulties, there's not really a one size fits all. It's not like when you've broken your arm and what we'll do is we'll put a pin in there or whatever, we'll pop it in a cast and that will sort it out. It's very much sort of picking and choosing what works for you, and people find a combination of many different types of support can be useful to help them improve their mental health. So we hope that we can be part of that jigsaw puzzle, and we hope that we can be helpful in that with you. Just a couple of little other things to note in coming into the service. If you feel that this kind of support would be helpful, we ask of you that you share a little bit of information about yourself with us, so we can share that with our volunteers and they can kind of get stuck in with you and understand where you're coming from straight away in that support. Anything that you share with us, it will be kept within the service and will be kept private. We would ask your consent to share anything outside of Parents in Mind, and as I said, we're completely independent of anything else. We are a charity, so we're able to keep any data that you share with us separate and private and confidential to us, and we ask that if you're in a group space, you respect the privacy and the conversations that take place in that space of the other service users and of our volunteers, and don't share them outside of the group. And we ask that of everyone that comes along, to keep it feeling like a safe space. The only time we might need to share information outside of our service without your consent is obviously we have a duty of care around keeping yourself and your baby and your family safe. And so obviously if we felt that sharing any concerns we had with you would further increase any risk to any of you, we may need to do that without your consent. But as I say, that would be few and far between, and we would respect your wishes as and where we can keep your information private to keep everybody safe. So in terms of the support itself, that's how it works. And if you would be interested, if you can pop me a text back, we can have a little natter on the phone and we can talk about sort of picking things up. And we do have quite a speedy turnaround. We have virtual support, we have remote support, we have our mums groups, we have our dads groups, we have partner groups, we have carers groups, as in like our grandmothers and grandfathers and people like that. So if you want to have a little bit more support and be able to talk things through, whether that's just in a couple of one-to-ones or in a more long-standing opportunity to come along to groups, please let us know. But thank you for listening. I hope that we can help, and very best wishes with your parenting journey. Bye.